we are going to combine a highly trained expert WOC nurse along with your remote patient monitoring and really offer that direct to your clinicians. So what we're looking to provide is a consultation by our WOC nurses directly to your clinician who may be in the home with the patient or in the doctor's office with the patient or in any outpatient setting. So your clinician is going to go ahead and get those wound images and some background information about your patient at admission or at that initial visit. And then all that information is then going to be seen by our WOC nurses. And they're going to go ahead and review all that information, all that data, utilize standardized evidence-based wound recommendations by care setting and wound type. They're going to take a look at all of that. And within 24 hours, they're going to bring you back a consultation that's going to include wound treatment recommendations. So how are we going to treat the wound? With what products? With what cleansers? What are we going to do there? We're going to make those recommendations. We're also going to make the recommendations on the wound etiology or the pressure injury stage. So this is going to be great for those home health agencies at start of care, for those nurses doing their OASIS. So we can really help them answer some of those questions and recommend to their physicians, the wound etiology and the pressure stage, so we can get the right products in, we can get the right treatments in and the right frequency. So we're going to be also looking at frequency. So recommended frequency, treatment, products, the staging, the etiology, and then also making recommendations on education to provide to your patients to help them heal over the next course of that length of stay. So we can offer that at the admission or that initial visit. And then we can offer follow-up visits as frequently as you like. So we recommend for home health that start of care visit and at least one follow-up visit so that we can come in maybe in 2 weeks and take a look at the progress of the wound. And if we're seeing any stagnant healing, we can go ahead and make some tweaks and adjustments there and then recommend something new and take a look at that. And then over the next 2 weeks. So that's really what this program is looking to really tackle. And then offering that remote patient monitoring and engagement solution along the way. So we have a wound consultant who's going to come in at certain time points. And then throughout the care, we're going to offer biometric tracking if that's needed for that particular patient. Maybe it's a diabetic patient, for example, and we're going to monitor their blood glucose. We're going to monitor their medications. We're going to go ahead and have them watch our videos and engage in the platform, maybe potentially having some physician appointments virtually through a tablet. There's all kinds of opportunity here when we combine that RPM and then this consultative process. And then we'll also offer some data, which is what everybody wants. So we're going to take some information from HRS we can provide to you on your patient adherence, your patient engagement, any of those tracks and trends of those biometric readings and survey answers. And then we can also provide from CoreStrata the recommendations that we've been making right along. So, have your clinicians been at the start of care, they've been calling these pressure injuries a stage 1 or 2 or 3, and we came in and recommended a stage 2, 3, or 4, for example, we can go ahead and compare and contrast all of that information and provide some great reports back to you monthly so you can assess the program and assess the outcomes. So we'll go ahead and build that sort of measure of success, if you will, to make sure that you're meeting your goals. So that's really what we're trying to do. We're really going to bring in, I think, a really first of its kind program to help you address these patients in the home setting.